I have chosen to divide the lesson on oral infections in two parts. In the first part, we will be covering viral infections. A couple of viral infection facts. There are an estimated 10 nonillion, 10 to the 31st power viruses on Earth. There are 38 trillion viruses in the human virome that inhabit human beings. The most current and the most destructive virus currently inhabiting humans is the coronavirus, or SARS-CoV-2. Please keep in mind that not all viruses are bad actors. Indeed, many viruses are benign or even beneficial to us. Fortunately, we will not be covering the 10 nonillion or even the 38 trillion viruses that exist. Instead, we will cover those viruses that most commonly exist in the head and neck area. The herpes family of viruses is extremely large. Primary herpetic gingivostomatitis is a manifestation of herpes simplex 1. Children 6 months to 5 years of age, but also adults, are most affected or are affected by primary herpetic gingivostomatitis. Transmission comes from direct contact and oral secretions. About 90% of the world's population is seropositive. In other words, they have been exposed to herpes 1, but 50% will manifest recurrent forms. The incubation period is 3 to 10 days. The duration is about 12 to 20 days and is usually self-limiting. The signs and symptoms of primary herpetic gingivostomatitis are painful ulcers and blisters, fever and malaise, lymphadenopathy, and difficulty speaking and eating due to the pain of the ulcers. It is highly contagious. Generally, primary herpetic gingivostomatitis is, as I said, self-limiting. Palliative measures can be given, especially in the case of those patients who have trouble eating or speaking. The recurrence of herpes simplex 1 can be intraoral and manifests itself in recurrent oral herpes simplex. This is relatively mild or a relatively mild recurrence. The lesions are located on the intraoral keratinized surfaces, and the triggers for this seem to be stress and illness. Recurrent herpes labialis is also a manifestation of herpes simplex 1. Two notable issues with recurrent herpes labialis: the manifestation of prodromal symptoms. Just prior to the onset, the patient will report a tingling sensation in the site of the potential outbreak. And second, that it seems to be triggered mainly by sunlight exposure or trauma, but also stress is a factor. The signs and symptoms are ulcerations, scabbing, crusting, redness, and pain, and this too is highly contagious. Antiviral medications can be used to cut the severity and duration of the outbreak. When a herpetic lesion is touched with a bare finger with broken skin, the infection is transmitted to the finger, hence herpetic whitlow. The physical signs are identical to the recurrent or primary manifestations. So herpetic whitlow is picked up with direct contact with inactive lesions, and pretty much the symptoms are the same as the oral version of herpes. In Dental Hygiene 366, we spoke about varicella zoster and chickenpox. In chickenpox, the signs and symptoms very quickly are rash, fever, loss of appetite, headache. The spread is by contact with rash or oral secretions. Chickenpox has been pretty much brought under control due to vaccinations. However, if the individual contracts chickenpox, the measures are usually palliative. In other words, minimize the itching, scratching, and the patient's giving acetaminophen for fever. Varicella zoster virus, the virus that causes chickenpox, will continue to reside along the neurons even after acute disease goes away. When the individual's immune system is compromised, it may allow the varicella zoster virus to manifest itself. Note the pattern of the outbreak. It follows the path of the nerve. So shingles is a secondary form of varicella zoster. There are painful ulcerations and blisters along the neuronal pathways. And the signs and symptoms are prodromal tingling in the site prior to outbreak, fever, headache, chills, and upset stomach. Infectious mononucleosis is caused by the Epstein-Barr virus. It is called the kissing disease because it is highly transmissible through saliva. The disease can be moderate or severe. The symptoms are lymphadenopathy, malaise, pharyngitis, fatigue, and fever. Petechiae are sometimes noted in infectious mononucleosis. It is thought that the patient creates suction with their tongue to ease the itching and soreness of their throats. We are now leaving the herpes families of viruses. Coxsackie viruses are enteroviruses. Herpangina and hand, foot, and mouth disease are mainly diseases of children. The two diseases can be distinguished by their location. Herpangina occurs in the throat, and hand, foot, and mouth occurs, as you might well surmise, in the hands, feet, and mouth. It is self-limiting, and the only complication is that it may be severe enough that the patient cannot eat or drink due to discomfort. So here's some examples of the Coxsackie virus, herpangina. Notice its location on the posterior throat area and hand, foot, and mouth with its distinctive lesions on the hands, the feet, and the mouth. The human papillomavirus, or HPV, has taken on increased prominence due to the discovery of its role as a causative agent in oropharyngeal and cervical cancer. Oropharyngeal cancer affects the mouth, the throat, the base of the tongue, and the tonsils. And 70% of oropharyngeal cancers are caused by HPV. The signs and symptoms are long-lasting sore throat and hoarseness, ear aches, lymphadenopathy, pain on swallowing, unexplained weight loss, and sometimes is asymptomatic due to the fact that if it is very much at the base of the tongue, there are really no symptoms for the patient to note. The strain of HPV that causes oral cancer is HPV 16. Note, 80% of individuals will get an HPV infection. And second, cancer prevention extends to oral cancer causing HPV viruses. HPV 16 and 18 cause cervical cancer, and HPV 16 causes oral cancer. Note that two vaccines are available currently for prevention of HPV infections. They are Gardasil and Gardasil 9. And this chart shows the age range of vaccinations. The age range has been extended from 9 to 26 years. Here's an example of human papillomavirus-caused oral cancers. The one on the far left is kind of typical. It forms on the lateral border of the tongue. The other one is, almost difficult to detect. It's way back beyond, almost on the tonsillar pillars. Often HPV carcinoma is difficult to detect as it may occur at the base of the tongue, an area that is not readily accessible for examination. While oral warts, verruca vulgaris, which are caused by HPV, are rare. They can occur. It is a benign manifestation of HPV. Again, oral manifestations are rare, and it's considered a viral wart. The toga virus is the cause of rubella or German measles. German measles, as opposed to rubeola or regular measles, is less severe as a disease. However, there are severe complications if a woman who is pregnant catches the disease. They can be miscarriage, cardiac abnormalities, loss of sight and hearing for the child, intellectual disabilities, and liver and spleen damage. Rubeola is also a form of measles, but it's caused by a different family of virus, a paramyxovirus. The oral manifestation of measles or rubeola are Koplik spots, if you remember from our discussion about infectious diseases in DH366, which is a transient oral manifestation of rubeola. And paramyxovirus also causes endemic parotitis or mumps. HIV is also a virus. It's considered a retrovirus. Because of the nature of HIV, there are many diverse manifestations of HIV intraorally. Due to the advances in medication for HIV, it has become a chronic condition. These medications have also cut down on the number of oral manifestations that are seen with patients with active HIV status. Candidiasis is a fungal infection, which we will discuss in the next part of this lesson series. And we have just talked about HPV warts. The aphthous manifestation in HIV patients is major aphthous stomatitis. These ulcers are large, painful, and last up to 4 to 8 weeks. Kaposi sarcoma is a rare cancer which can be manifested intraorally. We would expect more severe periodontal problems with individuals with immune system disorders. The periodontitis is extreme with necrosis and ulceration, and the gingivitis is far more pronounced. Oral hairy leukoplakia was once considered to be the single sign of HIV positivity. Today, while it does occur with HIV patients, it can also be seen in non-HIV positive patients. The causative agent is Epstein-Barr virus. It is asymptomatic and sometimes confused with candidiasis. This concludes the part 1 on oral infections. Part 2 will cover bacterial and mycosal or fungal infections. Again, if you have any questions, problems, issues with any of the lectures, please do not hesitate to let me know.